The silent struggle. A look at the daily lives of those living with chronic pain. Chronic pain is a silent epidemic. It affects millions. Many suffer in silence. They try to hide their pain. They try to live normal lives, but the pain is always there. It's a constant companion. Imagine waking up every morning with an ache in your lower back. It's not a sharp pain, but a dull throbbing. This pain affects everything you do. Simple tasks become difficult. You might try over-the-counter painkillers. Maybe you see a physical therapist. You hope for relief, but often it's only temporary. The pain always returns. This cycle can be incredibly frustrating. It can lead to feelings of hopelessness and despair. Many sufferers feel like they are alone in their battle. Beyond the Band-Aid. Why traditional approaches to chronic pain often fail. Many traditional treatments focus on acute injuries. These are sudden, short-term events. Think of a sprained ankle or a pulled muscle. These injuries usually heal with time. Rest, ice, and medication often do the trick. Chronic pain is different. It persists for weeks, months, or even years. The initial injury might have healed, but the pain signals continue to fire. This is where traditional approaches often fall short. They treat the symptoms, not the source. Treating chronic pain is like fixing a broken alarm system. The initial trigger might be gone, but the alarm keeps blaring. We need to find a way to reset the system. We need to address the root cause of the problem. The nervous system's role. Understanding how our body's internal alarm system can malfunction. Our nervous system is incredibly complex. It's responsible for transmitting pain signals. These signals alert us to danger. They tell our brain something is wrong. Sometimes, this system can become oversensitive. It's like an alarm that won't stop ringing, even when there's no real threat. This can happen after an injury, surgery, or even due to stress. When we experience chronic pain, our brain is stuck in a loop. It continues to receive pain signals, even when the tissues have healed. This can lead to a cycle of fear, anxiety, and avoidance. Section 4. A tailored approach. Moving away from generic solutions and towards personalized care plans. Every individual is unique. Their pain experience is unique too. A one-size-fits-all approach to chronic pain management simply doesn't work. What works for one person may not work for another. A tailored approach focuses on the individual. We need to understand their history. We need to identify the factors contributing to their pain. This might include physical, emotional, and psychological aspects. Personalized care plans may incorporate a variety of techniques. This could include gentle movement, mindfulness practices, and stress reduction techniques. It might also involve addressing underlying emotional issues. The goal is to empower individuals. We want to help them regain control over their pain. Section 5. Retraining the brain. A three-phase method to manage and potentially eliminate chronic pain. I've developed a three-phase method to address chronic pain. It focuses on retraining the brain and nervous system. Phase 1 is about calming the storm. We need to reduce the overall stress response. This might involve gentle movement, breathing exercises, and relaxation techniques. Phase 2 focuses on rebuilding trust with movement. We start with gentle exercises. Gradually, we increase the intensity. This helps the brain relearn that movement is safe. It isn't a threat. Phase 3 is about rewriting pain's emotional narrative. We explore the psychological and emotional factors contributing to pain. This might involve therapy or journaling. The goal is to change our relationship with pain. Section 6. A new perspective on pain. Encouraging hope and offering a path towards reclaiming one's life. This three-phase method has helped many people find relief from chronic pain. It's not always easy. It requires commitment and effort, but the rewards can be life-changing. One of my patients, a woman who had suffered from debilitating back pain for years, was able to return to hiking and gardening after following this approach. She regained her life. This is just one example of many. This approach to chronic pain management is not yet mainstream. It challenges traditional views. But I believe it holds tremendous promise. Chronic pain doesn't have to be a life sentence. There is hope. By retraining the brain and addressing the root causes of pain, we can reclaim our lives.